Folic acid in pregnancy. Greetings and welcome back to my channel, everyone. If you would like to get additional weekly updates on pregnancy and related topics, remember to click subscribe. Folic acid is a B vitamin that is important for the proper development of the brain and spinal cord in a developing baby. It is recommended that all women who are planning to become pregnant or who are pregnant take a daily supplement of folic acid to reduce the risk of birth defects of the brain and spine. During the first 28 days of pregnancy, the neural tube forms and closes. Folic acid plays a vital role in the proper development of the neural tube. If you do not get enough folic acid before and during the first few weeks of pregnancy, her baby is at higher risk for developing neural tube defects, such as spina bifida. Folic acid can be found in a variety of foods, such as leafy green vegetables, nuts, beans, and fortified grains. However, getting enough folic acid from diet alone can be difficult, especially during the early weeks of pregnancy when the neural tube is forming. This is why it is important that you take folic acid if you are planning to become pregnant and are taking a daily supplement of folic acid. The recommended daily amount of folic acid for women who are planning to become pregnant or who are pregnant is 400 micrograms. Some women may need a higher dose of folic acid, such as those with a personal or family history of neural tube defects, those taking certain medications, or those with certain medical conditions. It is important to speak with your healthcare provider to determine the appropriate dose of folic acid for you. Folic acid is a B vitamin that plays a vital role in the development of the brain and spinal cord in a developing baby. It is important for women to get enough folic acid before and during the first few weeks of pregnancy, as this is when the neural tube forms and closes. If a woman does not get enough folic acid during this time, her baby is at higher risk for developing neural tube defects, such as spina bifida. In addition to its role in the development of the brain and spinal cord, folic acid has several other functions in pregnancy. Reducing the risk of other birth defects. Folic acid has been shown to reduce the risk of other birth defects, such as heart defects, cleft lip and palate, and abnormal formation of the face and skull. Reducing the risk of preterm delivery. Folic acid reduces the risk of preterm delivery, which is delivery before 37 weeks of pregnancy. Preterm delivery can have serious consequences for the health of the baby, so reducing the risk of preterm delivery is important. Promoting healthy placental and fetal growth. Folic acid plays a role in the production of red blood cells and in the metabolism of amino acids, which are important for the growth and development of the baby. Supporting the production of DNA and RNA. Folic acid is involved in the production of DNA and RNA, which are important for the proper functioning of cells. Overall, folic acid plays a vital role in pregnancy and is important for the proper development of the baby. Folic acid supplements are available over the counter and can be found in various forms, such as tablets, capsules, and liquids. It is important to follow the instructions on the label and take the supplement as directed. If you have trouble swallowing pills, there are also chewable and dissolvable folic acid supplements available. In addition to taking a daily supplement of folic acid, it is also important to eat a healthy and balanced diet during pregnancy. This includes getting plenty of folate-rich foods, such as leafy green vegetables, nuts, beans, and fortified grains. In conclusion, getting enough folic acid during pregnancy is important for developing the brain and spinal cord properly in a developing baby. It is recommended that all women who are planning to become pregnant or who are pregnant take a daily supplement of folic acid to reduce the risk of birth defects. If you have any questions or concerns about folic acid or your pregnancy diet, it is a good idea to speak with your healthcare provider for further guidance and support. Thank you for your time.